7 common medications that can damage your kidneys. Your kidneys work tirelessly, filtering waste, balancing fluids, and keeping your body running smoothly. But did you know that some everyday medications could be silently harming these vital organs? Whether it's a painkiller for a headache, an antibiotic for an infection, or a drug to manage chronic conditions, certain medications, when misused or taken over a long period, can put you at risk for kidney damage. This article explores 7 common drugs that can negatively impact kidney health, how they cause harm, and what you can do to protect yourself. Understanding these risks is the first step in making informed decisions about your health and ensuring your kidneys stay strong and functional for years to come. 1. Non-steroidal anti-inflammatory drugs, NSAIDs, including ibuprofen, Advil, Motrin, and naproxen, are widely used for pain relief and inflammation. However, they can reduce blood flow to the kidneys by inhibiting prostaglandins, which help maintain renal perfusion. How NSAIDs damage the kidneys. Increased prostaglandin production leads to reduced blood flow, increasing the risk of acute kidney injury. Chronic use may contribute to interstitial nephritis or papillary necrosis. Research has shown that long-term NSAID use significantly raises the risk of chronic kidney disease, CKD, particularly in older adults and individuals with pre-existing kidney conditions. Studies and cases. A study published in the Clinical Journal of the American Society of Nephrology found that individuals who used NSAIDs regularly for pain management had a 20 to 30% increased risk of CKD. Safer use recommendations. Use the lowest effective dose for the shortest duration possible. Avoid NSAIDs if you have pre-existing kidney disease or take them under a doctor's supervision. Consider alternative pain relief options such as acetaminophen, Tylenol, which has less impact on kidney function. 2. Antibiotics, aminoglycosides and others. Certain antibiotics, particularly aminoglycosides, for example, gentamicin, tobramycin, pose a risk to the kidneys by causing nephrotoxicity. How antibiotics damage the kidneys. Aminoglycosides accumulate in kidney cells, leading to cell death and acute tubular necrosis. Other antibiotics like vancomycin and certain cephalosporins may also cause kidney damage. Fluoroquinolones, such as ciprofloxacin, have been linked to kidney inflammation and interstitial nephritis. Studies and cases. A study in the American Journal of Kidney Diseases highlighted that aminoglycosides were responsible for up to 30% of drug-induced acute kidney injury in hospitalized patients. Safer use recommendations. Doctors should monitor kidney function during antibiotic treatment. Avoid prolonged use and opt for less nephrotoxic alternatives when possible. Stay hydrated to help flush toxins from the kidneys. 3. Proton pump inhibitors, PPIs, such as omeprazole, Prilosec, and esomeprazole, Nexium, are commonly used to treat acid reflux and ulcers. However, long-term use has been linked to chronic kidney disease. How PPIs damage the kidneys. PPIs may cause acute interstitial nephritis, leading to permanent kidney damage if untreated. Chronic PPI use has been associated with an increased risk of CKD and end-stage renal disease. Researchers believe that reduced magnesium levels due to PPI use may contribute to kidney damage. Studies and cases. A large-scale study published in JAMA Internal Medicine found that individuals who took PPIs for prolonged periods had a 50% increased risk of developing CKD compared to those who did not use these medications. Safer use recommendations. use PPIs only when necessary and at the lowest effective dose. Consider alternative treatments, such as H2 blockers for acid reflux. Monitor kidney function if long-term PPI therapy is required. 4. Diuretics. Diuretics like furosemide, Lasix, and hydrochlorothiazide help remove excess fluid, but can sometimes harm the kidneys. How diuretics damage the kidneys. Overuse can lead to dehydration and electrolyte imbalances, reducing kidney function. Long-term use may contribute to renal failure in susceptible individuals. Certain diuretics can cause a buildup of uric acid, leading to kidney stones and further damage. Studies and cases. A study published in Nephrology Dialysis Transplantation found that excessive use of loop diuretics was linked to a decline in kidney function, particularly in older patients with heart failure. Safer use recommendations. Maintain proper hydration while taking diuretics. Regularly monitor kidney function and electrolyte levels. Work with your doctor to adjust dosage as needed. 5. ACE inhibitors and ARBs. Medications like lisinopril, ACE inhibitor, and losartan, ARB, are commonly used for high blood pressure and heart failure. While beneficial, they can cause kidney issues in some individuals. How they damage the kidneys. These drugs can reduce glomerular filtration, leading to elevated creatinine levels. They may cause hyperkalemia, which can further harm the kidneys. Studies and cases. A meta-analysis in The Lancet found that while ACE inhibitors and ARBs are protective against kidney disease progression in many cases, they can also cause acute kidney injury when combined with diuretics or NSAIDs. Safer use recommendations. Regular kidney function monitoring is essential. Avoid combining these drugs with NSAIDs or other nephrotoxic medications. 6. Contrast dye used in imaging. Contrast dyes used in CT scans and MRIs can be harmful, particularly in individuals with existing kidney disease. How contrast dye damages the kidneys. Contrast-induced nephropathy, CIN, occurs due to oxidative stress and vasoconstriction. It can lead to acute kidney injury, especially in those with diabetes or CKD. Studies and cases. A study in the New England Journal of Medicine showed that CIN is a leading cause of hospital-acquired kidney injury, with up to 12% of patients experiencing renal function decline after contrast exposure. Safer use recommendations. Drink plenty of fluids before and after contrast dye administration. Consider alternative imaging methods if at high risk. 7. Chemotherapy drugs. Certain chemotherapy agents, such as cisplatin and methotrexate, can be nephrotoxic. How chemotherapy drugs damage the kidneys. These drugs can cause direct tubular toxicity and inflammation. Methotrexate may lead to crystal formation in the kidneys, worsening function. Studies and cases. A study in cancer research found that nephrotoxicity is a major dose-limiting factor in chemotherapy treatment, often requiring adjustments or alternative regimens. Safer use recommendations. Patients should be closely monitored for signs of nephrotoxicity. Adequate hydration and dose adjustments may reduce risks. While many medications are necessary for treating various health conditions, some can have unintended effects on kidney function. Understanding these risks and taking preventive measures can help protect your kidneys from damage. Always consult a healthcare professional before making changes to your medication regimen to ensure your safety and well-being. See you there. Stay informed, stay healthy,